Hi, I'm Dr. Sarah Ballister, board certified in periodontics and dental implant surgery, and I'm going to tell you about receding gums. Lots of patients have receding gums and are afraid to go in for treatment because they've heard horror stories from their friends who've had chunks of gum cut from the roof of their mouth or had really horrible surgical recoveries. I want to let you know that there's lots of options for receding gum treatment, and those can include laser treatment, using collagen sheets instead of taking gum from the roof of your mouth, minimally invasive surgeries, and other treatments. Don't let your fear get in the way of addressing your receding gums. Come in for a consult today. Lots of my patients have gum recession and are afraid to move forward with gum grafting because they've heard horror stories from their friends of getting chunks of gum cut off the roof of their mouth or having really horrible outcomes where it looks like there's a tire patch of tissue of another color in the area. I want to let you know that there's lots of different options for gum grafting, including minimally invasive procedures where we're not opening the gum or taking gum from the roof of your mouth at all. We can use collagen sheets and tuck them under the gum and use stitches to pull up that gum recession for you. That way you have an easier recovery and only one surgical site. Don't let fear or stories from your friends or Dr. Google get in the way of getting the treatment that you need. Lots of patients ask about options to treat receding gums. Sometimes they develop sensitivity in the area where the gum used to cover the root surface of the tooth, and they hear that there's lots of different alternatives and don't know which one to choose. One alternative is using tooth-colored material or filling material to bond on top of the tooth. When we do that, we're putting something that is not naturally there. So we're putting filling material where our body expects there to be gum. Yes, it does decrease the sensitivity, but it's going to give a different aesthetic result. You're going to have a longer tooth if you choose to use bonding to cover your exposed root surfaces. If you'd like a more natural look, I highly recommend gum grafting or gum rejuvenation, where we can put collagen sheets under the gum and lift your gum tissue up, making sure that there's gum tissue where gum tissue belongs. You'll also have a more aesthetic result because your tooth will remain the same size and shape that it was before you had gum recession. Gum recession isn't just an aesthetic issue, it can actually impact the long-term health of your teeth. Our teeth have roots that are supposed to be in bone and covered by gum, and the crown part that you see and chew with that's covered with enamel. When we have gum recession, we expose the root of the tooth. That surface is more susceptible to decay and can be more sensitive. So having that area exposed gives you a higher risk for cavities and decay and tooth loss. Also, gum recession can be progressive. We need gum on our teeth to seal the area and make sure our teeth stay in our jawbones. Sometimes we can lose so much gum that it becomes like a zipper and the whole area starts to open and unzip, or like a run in your stockings. So gum grafting can not only replace the missing gum, but it can prevent further gum recession from happening. If you're noticing that you have gum recession or increased sensitivity, I highly recommend coming in for a consult with a periodontist. We can take a look and evaluate the area to see if you're a candidate for gum rejuvenation or gum grafting, where we take sheets of collagen, thicken the gum, and replace that area. If that's not the treatment you need, we'll tailor one to you specifically. You may need laser treatment or another minimally invasive treatment to help with your sensitivity and rejuvenate your gums, smile, and maintain your teeth.